Hi, my name is Chelsea Johansson, and I'm going to be going over a lecture for peptic ulcer disease and the medication treatments that go along with peptic ulcer disease. This lecture is being provided to nursing school students in their second semester and their second portion of their medical surgical circuit. These students have been previously exposed to a portion of this information, so this lecture portion is going to start by giving them some reflection questions. I want them to be able to participate at the beginning of lecture and go over things that trigger them with what they already know about peptic ulcer disease and the medications that go along with it. These are a few of the questions that we're going to have them be going over and thinking about. What causes peptic ulcer disease? How do they diagnose peptic ulcer disease? What kind of treatment plan is typically created for patients with peptic ulcer disease? And most importantly, what medications are prescribed and what are their modes of action? Once they have completed a few minutes of brainstorming and discussing in class, we will begin our lecture portion. Peptic ulcers are sores in the lining of the stomach or the intestines that can cause pain and sometimes bleeding. They can be classified as gastric or duodenal ulcers. The most common causes of peptic ulcers include extensive use of NSAIDs and aspirin, or they can be caused by a bacteria known as Helicobacter pylori. Symptoms of peptic ulcers can include burning, like heartburn or pain in the stomach, bloating, intolerance to fatty foods, and nausea. Severe symptoms can include bleeding, dark blood in stools and emesis, unexplained weight loss, and excessive vomiting. How to test for peptic ulcer disease. So when you're testing if you are positive for peptic ulcer disease, they're going to see if you're positive for the bacteria Helicobacter pylori, also known as H. pylori. They can do an endoscopy where they put a camera down to visualize any peptic ulcers that may have formed in the gastro lining. And then they can do an upper GI series where they can even put dye in to highlight where the peptic ulcers have formed in the gastric lining. Treating peptic ulcer disease. So treating peptic ulcers can depend on the cause. If you are suffering from peptic ulcer disease due to Helicobacter pylori, you're going to be prescribed antibiotics to rid of the bacteria causing the peptic ulcers. This can also be coupled with lifestyle changes, including excluding fatty foods and decreasing alcohol intake. If your peptic ulcers are caused by a different source other than Helicobacter pylori, like long-term NSAID use, there are two common classes of medications you prescribe to help treat peptic ulcer disease. These include H2 blockers and proton pump inhibitors. And we're going to go over those two medications now, covering their mode of action, proper use of those medications, and any contraindications in those medications. H2 blockers, or histamine blockers, work by reducing the amount of acid released in the stomach during digestion, which decreases the symptoms of peptic ulcer disease, like heartburn and pain. Some examples of H2 blockers include ranitidine, also known as Zantac, famotidine, also known as Pepcid, and cimetidine, also known as Tagamet HB. So to go a little deeper into H2 blockers, their mode of action is that they are antagonists at the H2 receptors in parietal cells, which are the cells for digestion. This suppresses, H2 blockers suppress the basal and meal-stimulated acid production, which then would lead to the symptoms of peptic ulcer disease. The proper use of this medication is that it should be taken as directed. For example, if you're prescribed once a day, it should be taken at bedtime. If you're prescribed this medication twice a day, once in the morning, once at night, and if you're prescribed several doses of this medication, take one in the morning and one at night, as well as taking them before meal times. Contraindications for this medication include if you have kidney or liver dysfunction, and also to avoid irritants like acidic foods and alcohol when taking these medications. The second class of medications that we see prescribed for peptic ulcer disease include proton pump inhibitors. These also are known as PPIs, and they reduce stomach acid during the digestion process. Some examples of PPIs include omeprazole, also known as Prilosec, lansoprazole, also known as Prevacid, and pantoprazole, also known as Protonix. To go a little deeper into proton pump inhibitors, their mode of action is PPIs inhibit gastric secretion by inhibiting the potassium hydrogen pump. The potassium hydrogen pump lives on the apical membrane of those parietal cells, the cells we talked about that are aid in digestion. And this PPIs inhibit the secretion of the hydrogen, which is what is causing the acid. Proper use of these medications. Take PPIs a little differently than you would take an H2 blocker. PPI should be taken 30 minutes prior to mealtime. A common misconception of these medications is that people want to take them when they're starting to have symptoms or right as they're starting to eat their meal, but the most efficient use of these medications is to be taken 30 minutes prior to mealtime to allow the gastric system to adapt and decrease acid production while eating. Some contraindications of these medications include long-term use of PPIs, high doses of PPIs, liver and kidney insufficiencies, low magnesium levels, and if the long-term use is causing things like pain and headaches, to consult with your doctor and possibly have a change of medications. So another portion of this lecture is going to include creating a case study. So now that we've kind of gone over the basic points of peptic ulcer disease, some medication treatment options, and the most common medications and those mode of action and side effects, take those pieces of information and we're going to create a case study. So for your case study, you need to be discussing a patient that is presenting with signs and symptoms of peptic ulcer disease. The study must include patient presentation, lab work, orders and results, treatment plan, medications chosen, and the mode of action for the medications used. This project should be done in PowerPoint form and be submitted at the end of the week. For the close of this actual lecture, we're going to go into a short 5-question quiz that will cover the differences between H2 blockers and PPIs. So please prepare the notes that we've gone over for lecture so that you can use those for your quiz. Thank you very much.